So it's always valuable, something like this innovation leadership exchange, because it's bringing together senior people, government, health entrepreneurs, clinical entrepreneurs from lots of different countries. So that's always valuable in itself when you come together to share experience. But what I think this is really showing is that we are all facing the same issues, it's just a question of scale. So clearly, Iceland, with a population of 350,000 people, Estonia, with a population of 1.5 million, have been able to adopt more digitalised health records than we have in the UK, with a population of well over 60 million. But some of the issues they talk about, silos, trust over patient data, things like that, are all exactly the same things that we face here. And I think what this really shows is that whilst governments are really keen to promote the adoption of tech and innovation into our healthcare system, and that's really changed over the last few years, what it really boils down to is getting the trust of the front line, so the clinicians, doctors, nurses, AHPs, the people who are going to implement these solutions on patients' behalf. So in that way, the challenge is about scaling up very much that sort of ground level challenge of how do you get the trust of the professionals without whom we can't implement any of these innovations. So AHSNs are a national network of 15 organisations covering the whole of England. And the reason we're 15 regionally based organisations as opposed to one large corporate is that you can't do this sort of thing without trusted local and regional relationships. So you can't just send out a set of slides and say you now need all maternity staff to use magnesium sulfate in preterm babies. It actually has to be explained by QI professionals and by nurses in our hospitals and in our primary care settings by people whom they all trust. And so it's the regional coverage and the permissions that proper local and regional relationships give us that enables us to do this work. I think the reason the UK does this is we're a large country. We're over 60 million people, or in England over 50 million people, which is covered by the AHSNs, and you need a field force like the 15 AHSNs to do this work. I think potentially if you're in a smaller country there may be other ways of doing it, but it doesn't remove the basic lessons of change management, which is that it happens at ground level.